We are very proud of our residency program. We're very young. This is only our third year, but we, with a lot of hard work, with numerous participants, we received an 8-year accreditation from the American Society of Health Systems Pharmacists. Rather unusual. We are a small organization, but we are a dynamic organization. We're small enough to make you feel wanted every single day that you're here, but yet we're big enough and demanding enough to teach you how to communicate, and I don't mean texting. I mean communicating, interfacing with both patients and fellow coworkers in the healthcare team, which is critical these days.
We're a young staff. We have a lot of excitement, and that was another thing that really drew me to this program. I feel like I'm working with people who are at my level or even above my level, so I can rise to that occasion. It's really a great environment to work in.
You get a lot of hands-on. I think there is a lot of patient interaction. So like I've mentioned before, you're responsible for your patients on the floor. So not only do you run with them with the medical team, but you also get your one-on-one with your patient. You are part of the transition of care as well. So we have a Meds to Beds program where we do a lot of discharge counseling and medication education to the patients.
Norwalk Hospital is very technology forward. We have a fully automated central pharmacy. We have the brand new Omnicell XR2 robot, and we have a carousel. We're a traditional cart fill hospital, so our nurses spend more time at the bedside with our students and preceptors, and I think we offer a very great rotation for pharmacy students and participation with the medical team.
What they're getting is an inpatient experience, ambulatory experience, and retail experience all packaged into one. So they will get clinical experiences in your general medicine, critical care, infectious disease. You'll get outpatient experiences, ambulatory care experiences in infectious disease clinic, as well as endocrine clinic. You'll get exposure to working with our retail partners and doing Meds to Beds. And you'll get a lot of administrative pharmacy, as well as the exposure to a lot of operational pieces in the program.
We make chemotherapy for patients, and we make it as they come in for them. It's all precision made, so there's no bulk processing on this. It's all individually done. All of our meds are kept in negative pressure rooms so that they can't cause harm to any of the people that work here. And all of our compounding is done in our compounding area, which is again negative pressure and sterile.
Norwalk is a great community. We're strategically located between New York City and Boston, with many places to dine, in places just north of here. There's many farms, and we absolutely have the water and the beach, and you're not too far from skiing as well in the Berkshires.
So we're fortunate enough that our preceptors take a big interest in the program. They're very dynamic. You will get terrific vibes from our preceptors. Once you get done with it, you will be able to go anywhere, and I mean anywhere, to work.
By being a little bit more of a community hospital, a little bit smaller and tight-knit, you are able to interact with everyone. You get to know everyone, and that's how you really build your relationships for later on in the period. Even now, the leadership has already talked about us taking jobs here after we're done, and really wanting to keep us because of the experience that we've already had with them.
The support is second to none. Having one of my co-residents by my side who we love spending time together. It's really just a good atmosphere every day. On top of it being a lot of work, you enjoy what you're doing.